Louisiana's flu season may be among the worst in the country right now. The state health department says Louisiana's flu positivity rate is about twice the national average. And although millions of people get the flu every year, that doesn't mean that it's not serious. We get some thoughts on all of this from Dr. Sarah Schwertner with Primary Care Plus. Good morning to you.
Good morning. How are you doing?
Not everybody has had the flu. And when you get it, you will know it. I mean, it can really knock you.
Yes, it can really make you feel bad. And so it's really important that you get your flu shot every year.
Everybody? Even healthy people need the flu shot?
Everyone over the age of 6 months should get the flu shot. And especially people who have chronic medical conditions, the elderly, pregnant women, and children from 6 months to 2 years old.
Unfortunately, we have a lot of experience with respiratory disease and talking about it over the last few years and thinking about it, but it spreads basically in a common way with water droplets in the air. And
yes, so through personal contact. So someone could be talking to you, sneezing, coughing, and if you inhale those tiny water droplets, that you can get the flu.
You know, there is so much pushback about vaccines. Are you seeing some hesitancy to get the flu shot as a result of everything that's happened in the last few years?
Yes, we do. One of the common myths are that the flu vaccine can give you the flu. We do not have live viruses in the flu vaccine anymore, so you won't get the flu from the flu vaccine.
But in rare cases, and I've gotten the flu shot maybe 25, 30 times in my life, but there was one night where, whoa, I felt terrible. What happened?
So when you get the flu shot, your body starts to make antibodies against the flu. And sometimes you can have symptoms such as fever, chills, weakness, but it only lasts maybe a day or two and is very mild compared to the actual flu.
I've heard doctors say in the past, too, that, you know, sometimes they miss the mark. This one's pretty good. The vaccine this year did a pretty good job at actually targeting the most common strain. Is that right?
Well, yes. So the virus changes every year. It evolves. So you definitely need to get your flu shot because the flu virus shot is going to be based on last year's strain. And so it may change a little, but it'll give you protection.
Its ancestor, of course, you know, in the teens, around 1918, 19, that time of period, around World War I, was the misnamed Spanish flu. That's the ancestor of what we deal with today, which is a lot less common. And is that what's going to happen with COVID over a period of time? Is it'll just become, you know, hopefully, if you will, something that's just, you know, changes and becomes
a little bit
becomes less harmful.
Yeah, it changes its configuration through each year, and so that's why it's important to get those new vaccines as they come out because you'll be more protected against the new strain.
In terms of you know, where we go from year to year, if you get the vaccine, even if you get the flu, it can still help you a little bit because it's not exact, right? I mean, you can still get the flu even if you had the shot.
You could still get the flu, but like I said, it'll be mild, and so it won't be as bad as if you've had 1 day of the flu. Anyone who's had 1 day of the flu, you do not want to have 10 days if you're not vaccinated. And so that's why I recommend that everybody get it over the age of 6 months.
So are you seeing that? What we're hearing is that it's really kind of worse this year than in a while?
No, I have
really?
Not in my clinic.
So you're not seeing in your clinic what the state health department is saying?
I'm not in our clinic in Metairie. So we have a few patients that came in. I've only had one person test positive for the flu.
That's all right. We'll take that.
Everybody's getting vaccinated.
One person, really?
One person.
Wow.
Yep.
Okay. Well, that's
October.
That's good to hear.
Yeah.
I'm not trying to, you know, make it worse than it is.
Let's hope it doesn't.
Good to hear, Dr. Sarah Schwertner. Thanks as always.
Thank you.